Well, my name is John Richard Pagan, and originally from California, or at least spent most of my life in California. Um, Done a lot of things to show my independence and self-creativity. I've been a travel agent, and I've been a IT person for 10 years. I have a bachelor's in computer sciences. I then went and owned a coffee shop for 6 years and had marvelous success with that in a mountain community near San Diego. And and then after that, moved off the mountains into the Palm Springs area and got my master's in marriage and family therapy, clinical psychology, and was a therapist at the local LGBT center. And then decided to go get my doctorate and was working on my doctorate in 2013 when I started to notice that I had that I was having issues with my tests.
I wanted to ask you a little bit about the LGBTQ work that you're doing.
Mm-hmm.
Anything in particular that you've noticed about dementia in that community, or
we're not doing enough for that community. You know, I'm a gay man, and so fortunately for me, if I wake up and forget what year it is, I will probably wake up and know that I'm a gay man, just a different time in my life. What about the transgender individual, the trans individual who was born female, became male, and suddenly wakes up one day and forgets what year it is, and they remember when they were female? And they look into a mirror and they think they're female, but they see a male body. We're not doing enough to support the LGBT community. LGBTQ, you're absolutely right. Community, we're not doing enough to support. We're not doing enough when we think about the fact that that the LGBTQ community is less likely to go see doctors because they're afraid of the stigmas, the ridicule that doctors give sometimes when they get honest about themselves being gay, lesbian, transgender, queer, bisexual. So they're less likely to go for help. They may be single, or they may be in a relationship where their partner is unwilling to take this journey with them. And for some of them, there won't be a chance to go home to a parent.
Right. And I often consider, what about, folks who never had the family support.
Mm-hmm.
We've been able to marry legally now for, I don't know how many years it's been, 6, 7, something like that. But there are still a lot of folks who didn't legally get married, even though they've been in long-term or even lifetime partnerships where families don't support. So if you have someone who goes into care and the family is not supportive of that partner,
right,
they're cut off.
Right.
And I think that there are just a lot of complex situations that we don't understand.
And when you talk about the LGBTQ community who are minorities, as well, in that they're African American, Latinas, there may be also cultural issues that have come up earlier in their coming out process that say, I was disowned when I came out to my parents. They won't accept me back. So, what do they do? So we're not doing enough for support. We're also not doing enough for the fact that for someone like myself who am a gay man and I return to my parents' home. Now my parents are older. We talk always about taking care of our children when they have dementia. Our children taking care of us when we have dementia. We talk about that, and we talk about spouses taking care of someone with dementia. But how often do we talk about the parents taking care of their children, the parents who are aging at the same time that they're taking care of children? And that happens more in the LGBT community. So we need to be more aware of that. There's just so many complex areas that we're really not doing enough for, and that we've got to be willing to look past what we call our social norms and see the greater complexities that are out there, that are part of larger, structures of community. Whether it's the LGBT community or it's the aging, or we have to look at all these structures and say that these are important too, and they need the same support.
I think it's just like we say, when you've met one person with dementia, you've met one person with dementia.
Yes.
That's the whole story across the board. I mean, it's, we've got people who are aging in the adult disability community, who are in similar situations where you've got parents who are taking care of adult children and yet they're aging as well. And it's so, we've got to stop thinking that it fits in a box, that it's a child taking care of a parent or just a spouse. And not everybody that has dementia is 80 years old.
Yeah.
We really, and that's why part of the reason that we want to do these videos is we really want to show that it's all different people from all different walks of life, and this is affecting everybody, and we just gotta love each other and support each other and move forward. We need more resources. We need more support groups. We need care homes for LGBTQ communities.
For sure.
We need integrated care homes for people who are used to being, like I grew up in a fairly urban setting, so I'm used to being around all different types of people. I would love to know that if I had to go into a facility at some point, that all of those different types of people would be present and not just this one.
I'm 54 years old. And by the way, I'm not the youngest that I know who's had dementia. I know people that have been in their 40s. I've heard of people in their 30s. I know of infantile, dementia and all these other types out there that are also very real. But I'm 54. I am hoping that I'll get to 65 so I can become eligible for Social Security retirement. Hopeful, but we also know that with dementia, with Lewy body dementia, the life expectancy is 2 to 20 years. So I'm hoping to be on the long side of that. But my parents worry all the time. What happens if something happens to them? Where do I go?
Hey folks, thanks for watching. Please like and subscribe to help us spread TEEPS's positive approach message around the world. And don't forget to click the bell to get notified when new videos are posted.